that.
I know, but last time I did that, my thing got canceled. My
Great.
internet decided, yeah. So I'm just, I
That's
probably just
true.
need to
That's true.
fix
That's a
the
good point.
situation. Okay, we're live. Oh my gosh, America, here we are.
Wow. It's been a
We've been gone a
while.
while.
I forgot we had a show.
I didn't.
I did, I did
People
too.
keep on messaging me about being on it.
People
So
did
that's
not stop
Oh,
messaging
well,
Melissa.
that's okay.
Melissa.
I was kind of enjoying not having to. What do you need? Where are the water bottles? There.
Tell your child that you are live on the internet right now.
I'll be.
Mommy is working.
Mommy's doing business. Yeah, I was kind of enjoying not having to do something at 4:30 on a Friday, which loyal fans, you all should know, the time we picked had no meaning other than that is when we were available the first week. So Lucas, aka Big Data Daddy, what?
Is that the real reason why?
That's the real reason why.
I mean, I didn't start with you guys. You kind of just like had me come in. I just thought it was because like an end of the week roundup.
No, here's the thing. Here's what happened was, Lisa said yes. And so I had to maximize the opportunity, and she just happened to be free, both of us, at 4:30 on Friday. It would have been better
We can change it.
1 p.m. on a Thursday.
I think that this is the right time to do an end of week roundup on all of the things.
All right.
This is what's a lipstick on? Lucas, quickly introduce yourself, and then we're going to send you to the backstage so you don't get fired for anything we say.
No, not at all. But thank you both for the opportunity to participate on this. Long-time listener, I guess, for a long time of a year. But I am what am I? I have been in health for a long time. It feels like forever, and it certainly is captured in my appearance, but have been a public health official, worked for State of Louisiana Department of Health, have worked in health technology, and have done global health security work overseas, and then back in DC, consulting and helping organizations and entities really understand how to offer effective care in a way that drives value and, most importantly, improves the lives of patients and communities.
Awesome.
What? And also,
sounds like you do real stuff, which is amazing.
No,
yeah, you do real
no.
business. So America knows though. Last time I hung out with Lucas late into the night, I did learn that Bergen County is the best place on earth.
That's where I live.
Okay.
Do you live in Bergen County?
Wait, who's in Bergen right now?
Melissa.
Oh, really?
Did you know?
Yeah.
The promised land.
So yeah. I grew up in Mawa, and so.
Oh my God, I worked in Mawa. My kid goes to school in Mobile.
Listen, you put two people on New Jersey on the line. We'll talk 3 hours right here.
Okay, Lucas. We'll see you in a half hour. Melissa, we'll see you in a half hour. Jesus Christ, I didn't know that was going to happen. Anyway, okay, we got some big news. Okay, I think the most important news, however,
the biggest news is that the Pope has definitely been to a Wawa. Just to be clear.
Have you seen the Philly internet is on fire? Like they're like, Villanova, he's one of us.
Pope has been to Wawa. Very important news for the denizens of Wawa.
I mean, God bless America is all I gotta say about that. But the second biggest news of the week is, I don't know if everybody noticed, Lisa's LinkedIn change. Actually, I think her new boss or new CEO guy decided to just announce this for her because she was
Abhinav definitely scooped me, but that is his prerogative as the CEO of Innovacer.
Yeah, so Lisa now works at Innovacer, y'all. That's like her job. What? Head of External Affairs, super cool.
That's great. That's great.
Congratulations, Lisa. I am looking forward to knowing more about what Innovacer does.
Yeah. Do you want me to tell you what Innovacer does, or do you want to just wait and find out later in your life?
You're going to give us a quick pitch here, but I will tell the funny story that I was saying like several months ago, sometime in Q4 of 2024. I was like, I don't even know what Innovacer does because they raised that bucket load of money.
They did.
And then I believe 2 of their executives reached out to you to say, would you like us to tell her what we do? But now my bestie works there, so like, what are you gonna do? So what does Innovacer do?
Great. So Innovacer is a very large health data platform company that has a whole bunch of applications off of that. And so they have this data activation platform. Think of it as like, if you think of an EHR as a system of record, for a health system or enterprises. You can think of Innovaccer as like the system of intelligence on top of it that brings in all the different pieces. So you got to do that first, and then you can build all these different applications off of it for different players in the healthcare system. They do a lot of work with big health systems providers like KP, like Banner. They do work with payers. They do work with the emerging sort of public sector space like CIEs and social health information exchange. And then they also have a couple other important business units like experience in the healthcare sector, and then also pharmacy quality solutions. They have an actuarial business with a bunch of CMS data work. So like the full scope. This is a really ambitious big company, and I'm super excited. And like I'm doing policy, industry coalitions, external relations, government relations, like all the things.
That's right, America. Lisa is now
Yeah,
a business person.
right. Yeah.
Oh,
So
that's what I'm talking
before,
about.
when I was not a private sector person, Kat could easily make all kinds of accusations about my focus. Well, I was in big, like real business meetings today. So it has
Big
moved
time.
on. I am competing with Kat for like queen of the private sector now. We'll see who wins.
We'll see what happens. I don't
We'll
know.
see what
I will
happens.
say, Lisa and I were at dinner with Matthew Holt and Leslie Kirk,
That's
the
right.
real Leslie Kirk. And Lisa, some of the things she was saying, I mean, even Leslie was like, you sound like a Republican.
Yes, and Mary Sarah says local government. Exactly. There's a whole like area that Innovator's working on around like local government, local, state, certainly not federal yet, but we, as you know, my background will hopefully be chopping it up with our friends in the federal government at some point in the future. And it's very exciting. And we have this big platform announcement happening on the 22nd, and I have just learned that I am very likely to be the moderator of this big announcement that's going to be broadcast all over the internets. So when we get the stuff, we'll share it with the
Well,
five
you're good
loyal
at
fans of the talk show.
broadcasting live across the internet. So I feel like
I
that's
would
going
like
to be
to think
great.
that I got that job because of the talk show. So, Kat,
I would
once
like to
again,
think
your
so
best
too.
idea.
Yeah,
There you
yeah,
go.
yeah, yeah. Best idea 2023. Not sure my best idea 2024 was, or 25. But you know what? Some people only get one idea their whole lives, so I feel grateful. All right. So, okay, we got a lot of personnel announcements. Some of these are a little old, but we're going to dig into them. So everybody knows Jim O'Neill's nominated to be the DepSec. He had his hearing this week, and Lisa forwarded me this a Medium piece, a Medium post, or is it Substack? I think it's Medium. Just about like kind of his vibes. Y'all should read it. Kelly Turner is the author. I mean, I'm
Interesting.
in general down with libertarian bullshit. Like, kind of into it. Obviously, I think we should have like police officers and like roads and stuff. But I'm kind of into the vibe. And he's, I don't know, Lisa, I'm interested in your thoughts on Jim, but from what I can tell, he's a Peter Thiel guy, kind of believes in the great free private sector. Like, I'm down.
Big time. Yeah. I mean, this guy, like, you cannot accuse him of being inexperienced or unqualified for the role. Like, DepSec is
Right.
a really, if you're not familiar or loyal fans, DepSec at HHS is a really, really important job. It's like the guy who runs all the actual stuff at HHS. And he is incredibly influential. Yeah, he's a Peter Thiel guy. Was an investor in Palantir. He was the head of the Teal Foundation, I want to say. So very much in that frame of things. And yeah, the typical questions you have about like what's the right level of regulation in HHS and in the nation's health agencies. I love not getting listeria. Really big fan of not getting listeria. So I hope we just continue to not get foodborne illnesses, for example.
Yeah. I think
Stuff.
that's fine. This article does go into, as you can see here, talking about his belief that drugs should be approved based on safety, and then we figured out later this is something that patient advocacy groups have been fighting
That's
for a long
already
time.
happened. Sorry. Like, I don't think that's like actually, like, I think they don't do a great job of like proving efficacy, but they do prove
Well,
safety.
it certainly does delay time to market, and a lot of these patients, especially those with rare diseases and interesting stuff, like really want this to happen. And this is how it happens in Europe, I believe. I don't know if it's country specific or EU wide, but like I'm in, like whatever.
Whatever.
I do think that's a communications challenge, right? To just explain to people like, we don't know what's going to work, but it's probably not going to kill you.
Well, that's
So,
fine. Then make all payment be based on outcomes. If it actually works, you get paid. If it doesn't work, then whatever. like fine. But you can't charge billions of dollars then if you haven't proven efficacy, in my opinion. For example,
In
Jim
case anyone
O'Neill,
from
DevSec,
pharma would like to
yeah,
send some
yeah,
emails to
yeah,
some hate mail to
yeah.
Lisa, you can find that all over the internet.
DevSec O'Neill, call me and I'll give you my great ideas.
So big news of the week, Casey Means is now the nominee for Surgeon General of the United States of America. There's been a lot of criticism about this, even from RFK Jr.'s former running mate, Nicole Shanahan. She was like, WTF, motherfucker, you said you weren't going to do this. So there's definitely a lot of criticism here. I believe the other nominee was pulled because they believe she misrepresented that she went to a different medical school than had listed, but she did in fact go to medical school, and I believe is a real medical doctor that has completed residency.
So this is the funny part about this is that Jeanette Nishaiwat, I think that's how you pronounce her name. She was the previous nominee. She went to medical school in the Caribbean at like the American University of the Caribbean. It's perfectly legitimate. She has a medical degree, and she did her residency critically in the U.S. at I think it was a primary care family medicine clinic in Arkansas. A lot of foreign medical graduates do then go and finish their residencies in a specialty in the US. It's not as easy for a foreign medical graduate to get into a US residency training program, but like there's nothing wrong with that. Now, if she like lied about it, cool, whatever. But it's so funny because Casey Means, I actually follow her on LinkedIn. She has like some great wellness content, but she like didn't even finish her residency. She was like, this sucks. I'm going to be a functional medicine doctor. I hate the system. So it's like even more of a poke if that's the reason they're
Yeah.
saying that Janet Nishiwa shouldn't be the Surgeon General, because Casey Means didn't finish her residency. She said through the system, like I'm gonna work on functional medicine, and like dropped out of her residency. She did go to Stanford though for medical school, as far as I recall.
That's
So she's like
fancy.
very credentialed, but like she didn't do her residency. So,
Yeah.
just like a little like six
Yeah.
of one, half dozen of the other, as far as I'm concerned.
I think it was probably like some sort of political favor, because they did say the other lady,
For
whose
sure.
name I cannot pronounce, but you did a great job, Lisa. She'll be in a different role within HHS, and I was like, okay, whatever.
But she
The other
was
thing
like
I'll say,
she was a real doctor during COVID. She
yeah,
was the medical director at City MD in New York City. Like imagine the like talk about volume of clinical encounters, probably a lot.
right, yeah. I'll also say every doctor who's real that I ever met, like every doctor that actually practices, like went through residency and did stuff and like fellowship and all that, say that the Surgeon General is the biggest bullshit job in medicine. So
It's not a real
I'm
job.
not
It's not
entirely
it's
sure
fine.
this matters, dear loyal
Lovely
fans.
people, very nice
This is a
people,
PR
very
job.
kind. Yeah,
PR job from everything I can tell, like not a lot of power. So I don't know, like whatever. I don't know Casey Means. She didn't know me, so whatever. But
she writes a lot of.
hopefully,
I feel like you should follow her on LinkedIn, or at least she did used to do post like all of this like wellness content that I feel like you would relate to. It's like
I love
bone
wellness. Put me in a
broth,
red light sauna. Give me some turmeric
bone
pills.
broth, red
Yes.
light sauna, like
All right. Well, I mean, listen,
turmeric.
if that's what we're going to be doing, and we could flood the market with more
That's
effective
right.
and cost-effective red
That's
light
right.
saunas, that'll be a benefit for America.
Perfect.
Yeah, no, we have another young early careerist in a leadership role at HHS.
I don't know if you can call him a careerist. He does have a great personal website, though. I really enjoyed his website so far. It was very
I love some
stylish.
personal branding. We were
Yeah,
arguing
yeah.
about this. I mean, we weren't arguing. We were on some Signal thread with some people who we probably can't say we were with, but the argument was like, what the fuck? This guy's so young. And what I said, and I think Lisa, you agreed with me, was like, he has more experience than any of the rest of it. Like, AI is so new in a lot of ways, or at least this way of using it and thinking
This
about
part,
it. Like,
generative AI is new.
yeah,
Other AI is no longer new.
like someone who their whole life has, like, this is the world. Like, it's like the early days of being able to research on Google. Like everyone was like, oh my God. That said, I do think there is some benefit for understanding how the world worked and is still working as you transition into this new universe. And I do think management experience is useful, though I do not understand the structure of the chief AI officer role. Like, does he have a team? Is he more of like soft influence? Like, what's actually happening here? I don't know. But yeah.
I mean, listen, he's probably very smart. He doesn't have a lot of, management or operational experience, and that would be the challenge. At the same time, I have no idea what the chief AI officer is doing at HHS because
Me
there
neither.
really wasn't one. And there all the center of gravity is to say like, well, we're gonna let industry regulate themselves on AI and we're gonna do stuff from the White House. So like I don't know what this person does. I don't know what this role is. So TBD.
Yeah,
Model.
TBD. And if these people have strong teams that know how to get stuff done in the government, like that's great. That's freaking great. Like
Cool.
whatever. I think there's lots of way to do stuff, but good luck to him. Hopefully this will result in some meaningful, awesome AI stuff from the great federal government.
That's right.
Here for it. Definitely more experience than me in AI.
Not the me.
We have some more experienced by years of life people in other roles. This is nothing new, as Lisa noted in her Slack to me, but recognize that we never covered it. But we got a Clark Miner, CTO, Palantir guy. I think he's like pretty experienced, been around for a while.
Yes.
And I think he's the guy. He was like, depending on how everything shakes out with this org chart, which I think it no longer is shaking out in this way. ASTP ONC was supposed to report to this guy Clark on that one org chart. It appears that may not be true anymore for those of you following along and those of you with expensive lobbyists. You will know that will be true.
Yes,
so,
exactly. Exactly.
TBD. Yeah. Lisa, what about the other guy? Who's the other guy? Wasn't there another guy?
Those were the two people. It's Peter Bowman Davis and Clark Miner. So this is the question, right? As sharp eyes might recall, there were these three C-level executives who were supposed to be hired by the Biden administration. There was going to be this chief technology officer, the chief AI officer, and the chief data officer. And this chief AI officer and the data officer was to report to the CTO, and the CTO was supposed to report to the ASTP, who at the time was Mickey Tripathi. They hired these three lovely ladies. Two of them got immediately axed, and the third one, I'm going to protect her privacy. She is still around, just floating below the surface. She was a longer term, really experienced federal employee and didn't have the same lack of protections as the other two folks had. And so now we have the answer. Now the Trump administration has hired Clark Miner as the CTO and Peter Bowman Davis as the chief AI officer. So those two roles have now been filled, but we still don't know, like, is the ASTP still a thing legally? Is ONC still? We don't know these questions. Loyal fans, we have no idea.
We don't know. But like, I'm sure we'll find out. That's what I've learned about the Trump administration. I'm sure we'll find out eventually. I don't know. Speaking of Trump stuff, the big news of yesterday and today, or maybe the day before, is that we're going back to the most favored nation thing for drug pricing. We're just going to say, listen, you give us the cheapest deal you got.
They are gonna. I don't. Listen.
Unintended consequences.
Listen. I mean, it's you just squeeze one end of the bubble and the other end expands. You just keep squeezing and the bubble keeps moving. It's just nobody is gonna like roll over on this one real fast is my feeling.
Yeah. I do think it's important to think through all these unintended consequences, right? We're thinking about tariffs with like crazy shit like that. And, like, listen, you guys, not sure if anyone noticed, but like, I'm not an expert on tariffs. But I did hear something really interesting. I was listening to some like foreign podcast about tariffs and shit. And they had a really cool analyst who covers China for the US. And I think this might have been like a Wall Street Journal foreign special. I don't remember. I never remember anything. But, she was talking about how, I think it's Huawei, the chip manufacturer in China.
Huawei.
And apparently they're kicking our fucking asses now. Do you know why?
Yeah.
Do you know why, Lisa?
Because they had to innovate because we cut off one of their sources.
We were like,
asses.
That was Biden administration policy to say, no, we're not selling chips to China. So they fucking made their own.
They're like
better than ours.
Bet. Like we have a billion people and we're gonna just do our own thing. Yeah,
Whoa.
yeah, you know.
Yeah. So I do
Ooh.
think I don't know. I know there's a lot of arguments here. And also like yeah, like the US absolutely subsidizes a lot of the manufacturing of these drugs and research for other countries. But like
Yeah,
I don't
yeah.
know, like, as everybody knows, I'm a little right of center. I also believe in America being the fucking best.
Well, you and President Trump probably like the phrase most favored nation, but then you have to
Absolutely.
scratch then you have to scratch below the surface. Ooh,
I
this
just,
could be not good.
maybe. I think that's like a big, like, a lot of us capitalists are like, fuck yeah. But then it's also like, oh, then we lose a lot of our advantages for other
Ooh.
reasons. And you know what, Lisa? I like being the best. I like having a lot of advantages. And I feel like I will not have such advantages, much
Correct.
less like China making better chips than my favorite country, which is America, in case no one was listening. So I don't know. I don't know. TBD.
I don't think we should count other countries out. I think there are a lot of really smart people all across the world, and they are motivated when we look slightly down.
Yeah. Yeah. So more on the project formerly known as the Autism Registry.
Oh
Uh,
my God.
but this is interesting, Lisa, because you and I have been talking about all of us a lot, and so this is an interesting thing because it's one step more, and I think this information is kind of difficult to digest. So I don't think it's been getting very as much coverage as I think it should. This is not a registry, but they are using our friends at eHealth Exchange to pull patient records consented from patients who participated or people who participated in the All of Us project. So it's like a good chunk of medical records. I think they will have trouble formulating a full patient record, but I am impressed that they are trying and using eHealth Exchange, which was the original QHIN from like the 2000s or something. So that's great.
Yeah, no, I mean, listen, I think this is great. I hate the way that this was announced originally because again, like research that is privacy preserving is really important and we absolutely should be using and moving like health records around and, consolidating them using, the modern tools that we have to get a full picture of people's health in a non-anonymized and an anonymized way, depending on whatever the use case is. So like we should do this work. I hate that it came across in this way. I hate that people with autistic people and their families, that they felt like this was something that could target them. I'm sure it's very legitimate fear, but like we totally should be doing legitimate and safe and consented research. Like we should do this. So I hope that questions were answered and concerns were allayed because this stuff is really important. I'm not sure that the focus of this project necessarily animates me or motivates me because I think this is a very, very complicated situation with all kinds of factors. But there's tons of cool research we could do, not just in this area and tons of other areas. So let's do that.
Yeah. So I got to go to the Milken Global Conference, which, by the way, loyal fans, I should not have been there. I was gloriously unqualified to be in that crowd. It was awesome.
That's not true.
I was like a minnow in the Pacific. I always say I'm a whale in a glass of water over here. I was a minnow in the Pacific Ocean. It was wild. They were like fancy folk over there for sure. But one of the topics, I also got myself invited to this roundtable. I also was not qualified to be at about like drug development and talked to some really interesting people who were like, there's kind of some belief that they can get all these records from EHRs. That's, as we all know, not true for research. But they were, some of these people were referencing the UK Biobank as being like just an exceptional breakthrough for research globally, right? Like, we don't have anything like that in the US. Like, we don't. It's all proprietary, pieced together. Things aren't consented. Blah 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 blah. Not great. So I love two things about this project. One is a funny thing. Whenever I see that two government agencies under the same department have to partner, it just like cracks me up. Like, are you fucking kidding me? Like, that'd be like saying one arm of Innovaccer teamed with the other, and it's like a freaking announcement. Like, I think it is the dumbest thing. It means I obviously don't understand how the government works, but I'm just like, what? Like, can't we just say the government has decided to advance understanding of autism through blah blah blah? It just
This was
cracks me
this
up.
was this was the whole thing that I was like, when all of our like friends who are now coming into their government roles were like, what should we do? They have all these ambitions. I was like, you literally don't have the immediate access and authority to use data within your own agency. Like,
Yeah, that's
I
ridiculous.
understand, like, your ambitions are lovely and I support them, but like, you have at least a decade of like fighting internally to get access to your own agencies, government systems. And there's all
Amazing.
kinds of reason for that, like historical reasons, legal reasons, things that matter. But like, people really imagine the government has like one database, and they definitely do not.
Yeah, I imagine it that way often, and this always
They
makes me
do
laugh.
not. They do not.
Next press release I read is going to be the Incentive Public Affairs team teamed with the Market Access team to do a thing.
Amazing. You
Like
should do
what?
that.
I should probably do that. Yeah, I'll let you know when I have money to waste on the wire. But the other thing I love is that they are using existing things to solve a new problem they want to solve. Right? They're using eHealth Exchange, and they're
Nice.
using the All of Us work, which
Yeah.
kind of got abolished in the Biden administration.
And then
right?
unabolished, apparently.
Yeah. Okay.
Great.
I know everybody's mad about a lot of stuff. That's actually a really good thing. They're reusing, looking at what they have and using it. So,
Somebody heard our complaints of many years, and they're
definitely
listening. Very exciting.
100% people were watching the talk show when we talked about that. So just random news, which I know we haven't had a lot of lately, but I feel like there's so much random news. Cedars-Sinai team with redesign. They're gonna throw out a bunch of startups, which is cool.
Nice.
I haven't heard much from redesign in the past year or so. So excited about this announcement. Hopefully they'll do some epic shit. TBD. Yep. United Healthcare, which is the largest payer in the universe, bigger than most countries, claims to have 1,000 AI use cases. That's cool.
Yeah. Okay. Great.
To be clear, artificial intelligence on its own will never deny a claim, assures the insurer's chief digital and technology officer on May 5th, not to be confused with May 6th, 7th, 8th, 9th, 10th, or beyond.
Listen, this is yes, there are different use cases for AI. In fact, now my new employer works on many of them. But man, I would probably just not say anything if I were these guys. I don't know. Not commenting
I
isn't
wonder
good.
why they
Is
are
good.
saying that.
Yeah, I wouldn't say
I
anything.
feel like at some point when you're so big and I feel like there is merit to just being quiet. That's what I would say about that.
Just be quiet.
Yeah.
Don't talk about it.
Yep. But in hilarious news, it turns out that parking, y'all, is a massive revenue source for hospitals in America.
This is not hilarious. It's actually really freaking awful. Melissa Danino has a face. She's making a face at us right now from backstage. It's horrifying that there is so much money that is going to parking. And that's because hospitals are usually in cities and towns in really central areas. And the value of their real estate has been a target for private equity and all kinds of stuff. So it's bad. I mean, patients, caregivers having to go and pay a ton of money for parking, but also just shows you how messed up their revenue models are, that they have to be well, I guess we got to make some money on parking, Yikes.
Yeah. Well, as you can see here, it's kind of cut off. The Texas Medical Center generated $81 million from parking fees last year. And I believe what's cut off is that it's half of its revenue for the year.
It's so bad. So bad. So bad.
Yeah. But yeah, speaking of the commercial real estate thing, and this is the last slide I have. We have to remember what else we missed over the past 2 weeks because we were gone. This is also something, there was a lot of, I thought, real douchey statements that came out of the Biden administration about post-acute. Now, obviously, I'm extremely biased here because I represent a company that cares a lot about post-acute. But there's a lot of things there's consolidation and it's all private equity's fault for how these SNFs are being run and consolidated. Y'all, that's I think the other side of this is, how is parking and real estate the actual value to a lot of these healthcare facilities? Why is it that way? Well, it is, and why? It's because we don't fucking pay doctors. Yeah, expenses are high. We have not really given physicians a pretty significant increase in how they're reimbursed in a very long time. In most cases, doesn't even keep up with inflation. So they're valued more for their property. Post-acute facilities are largely bought by real estate investment trusts. not, anyone who cares about healthcare, because that's where the money is in those programs. They have super limited reimbursement rates, and I assume, although God bless them, they figured out the parking business, like that's something to monetize in a different way. But I think it's also like kind of tells a sad story.
Yeah, it really does. It really does.
Look at
And
me,
yeah,
look at me sounding like a Democrat.
no, it really does. And also, like, again, this is where then if there's this real mismatch between the value, the commercial value, the financial value, and then the value, like, of actually providing medical care to people is so out of whack, then again, like I said, this becomes a target for kind of unscrupulous private equity to like buy it and then like lease back the land to the company, which then gets saddled with debt and saddled with expenses that it just, it like perpetuates a bad system that again continues to sort of devalue the actual like care to human beings. So boo.
Yeah. Boo. And what other rumors have we heard? We've heard like so many rumors. I mean, the
I
big rumor is
cannot
there's
even keep
another
track.
like Riff Wave 2 or 3 or 7. I don't even know. Big one's happening in June, allegedly a little bit more strategic. I've heard 200 rumors an hour, and 205 of them are invalid, if you can do that math.
Well, and but also like we are all just waiting to see like does the economy start to get into a really extremely negative territory? There's a ton of uncertainty right now, and does do the economic outcomes and the polls and the things like that push the administration to change fewer things? Does it push Congress to cut less or cut more? Like we're all just in like we have no idea what's happening. I talked to somebody today and she was like, "This is a lost year." I was like, "Oh, great. Well, that's kind of grim." But
Yeah.
that's kind of where we are right now. We don't know what's going on. We have rumors galore and no facts.
Yeah, we have no facts. Like
Yeah.
anyone who tells you they have facts, like I don't know. I don't trust them. I don't trust them. But the other thing to say, kind of quickly about that, like how is everything going to shake out with the economy and how's it going to affect midterms? I know that's one of the, at least reported, one of the big reasons that the Maha influencers are being more integrated into the administration, right? Is because it's a younger voting bloc that may not have voted for Trump, but is like interested in the RFK Maha movement. So, we'll see how that goes.
Yeah.
Well, what else happened, Lisa? We should probably bring on our very legitimate guest.
We probably should. Yeah, I mean that's kind of it right now. We don't know anything else. Let's bring on our very legitimate guest.
Yeah. So also known as
Very
BigDataDaddy.
illegitimate guest. I think
Illegitimate
was the
guest.
illegitimate.
I don't know. So, like our LinkedIn post said, we randomly met Lucas at a bar, kind of, and he was just awesome. And he just got up. I think Lucas has given a speech at every one of the parties he's attended.
I think it's the only reason it's a requirement in order to get an invitation to the next party, was my understanding. So I don't want to miss out. So yeah.
That's good. That's a good move. So Lucas, I know you and your group, your consultancy, you guys work a lot on like public, like what's the vibe? Like public health stuff. Like what's going on? Like, what's happening?
Listen.
Do you know any facts?
No. I only deal in rumors at this point.
Understood.
Because it's this the sands are shifting. There's a lot of emotions and misconceptions that are coming from all over the place, and just trying to again always come back to the fact that public health is always under resourced. There's never enough money, and there's never been a national strategy that enables everyone to participate. And so, and I keep reminding people that our healthcare system is performing perfectly as designed. Right? There is it is, our EHRs bring more efficiency to an inefficient process. And so like, we should not be surprised over what these outcomes are. And it doesn't matter because public health will never be front and center. I think really the shift is having tertiary care just deal with more of the ramifications of not addressing this in further upstream. And so as a result, we're just going to see it more in tertiary care, and we're going to be playing catch up. And certainly I have very strong opinions over pieces and changes and what that means. But we will either come back to what we thought we needed, or we'll learn not to come back to it, because really public health has always been reactive to some outcome, whether it was dirty water, whether it was the fact that people were selling snake oil or other kind of therapeutics that weren't approved or had no value, or whatever it was. There are fewer instances in US government where something was proactive versus something that's reactive, namely because, particularly at the state level where health happens, because of, again, the way the Constitution is, federal government can either tax or they can incentivize. They can't provide direct health services. So it relies on the states. And as a state, and particularly as a former health official, it was more important that you didn't end up in the newspaper on the front page for doing something or making a mistake than it was on having a massive success. So as a result, there's this massive risk aversion that happens at the local level, because you have a governor who wants to be a president, you have a senator who wants to, or a local senator who wants to move to DC, like whatever it is, there are always more people that don't want something potentially bad to happen than encouraging to take risk to do something amazing. And so as a result, you have incredibly talented people who are hamstrung for one reason or another, that then builds up to, oh, well, state officials aren't qualified, or government officials are dumb, they're lazy, they're this, they're that. And it's really a leadership issue more than an employment or a structural issue. Leadership's part of that structure, but there are structural restraints that enable kind of things to happen. So going back to like original statement of public health, it's just going to cycle. It'll figure out. I mean, ultimately, I do believe that the public will be impacted, patients will be affected, and that we'll just have to innovate and figure it out at the expense of those people who are affected by whatever the changes are, for better or for worse.
That's an interesting insight about the motivations of government officials at the state and the local level. Yeah, you kind of have to like always be like, what's the governor's next plan? What's the state
Yeah.
senator's next plan? What is this person doing? Like there's a joke sort of that goes around that like every US senator wakes up every morning and looks in the mirror and goes, like, good morning, Mr. Mrs. President. Like they're just
Right.
like
Right.
they're like the dream is always there. You're a US senator, you're like, all right, it's gonna be me. So that's real.
Right.
That's real.
Well, Lucas, like as a state official, former state official, if you could ask for two things for your state, like let's go back in time, what are those two things you didn't have that you think would have made a huge impact?
Oh, geez. All right.
Money, unlimited money.
Listen, for part of the thing with money is, if you can put a plan together and a vision and bring partners on, you can eventually find the money. Someone will have the money, whether you can go pull down Medicaid match or private sector, not necessarily a PPP in a legal sense, but if you could get true public-private partnerships, there are funds, and there have been plenty examples of these programs that are coming in. What I wish we had was greater alignment across governments of, this is not a left, this is not a right. For our state, we believe that this can be a path. We won't all agree on it, but we're going to try, and acknowledging that we're going to make mistakes and we're going to embrace failure. There's a great video, and it's something that we do at our company, from the founder of Spanx, where growing up, her father every week would ask, what was your greatest failure of the week? And like they would celebrate it. It was like the thing of like, because if you weren't failing, then you weren't learning. And so being able to have that culture in state government of, we're going to make bets, we'll iterate, so then that way our failures are smaller, but we're going to learn and constantly improve, would have been really, really helpful. For me personally, the greatest lesson, my failure as a state official, is that I lost control of my budget. We were trying to do, at that point, really data modernization of, we're going to bring Medicaid together with our public health office and these other things and have kind of an enterprise architecture, whatever else. And in doing so, to make the money work, I kind of said, all right, well, my budget goes into the effort. And as a result, then when things broke apart, there was no budget left. There was no team left because it all went into something that got gobbled up. And then, in our case, in the state that I was working in, whenever the state budget needed to be reduced, you could take it out of only two pots, education and health. And so that's the stuff that got nixed. And then you're left without a program. So that was the lesson for me. No matter what it is, no matter the initiative, as a government official, you can never release your budget. You have to protect that thing, or then you will not have a program as a result. And then your employees' careers are in jeopardy because now there's no way to pay them. So that was a very hard lesson to learn.
Yeah, your greatest failure is like an administrative, like politicking situation. It's like a bummer that, that's where the hang up was.
Yeah, but it was an important lesson, and it certainly applied to the rest of my career. Of you don't need to be territorial, but you can't be naive in thinking like, oh yeah, we're all going to come together and make amazing things happen. Like you have to be very intentional about every move you make.
Right. What's an example? So you talked about like that a culture of like good failure, like acceptable failure, would be a big difference in public health. I agree. In your opinion, though, as someone who was accountable for the health of a state, what's an example of an acceptable failure in public health?
So, well, listen, you can have countless campaigns. I mean, let's take a vaccination campaign, right? You are not going to reach everybody. You're not going to convince everybody, and that's okay. You don't need to do that. But even if we look at something like the Healthy People 2030 goals, I mean, I love the notion of healthy people, and I think having metrics are important. But like at the end of the day, I mean, what did we really move? I mean, it's important to have transparent and look at it, but like we never really had programs that could move those metrics in a way that were meaningful. Or we spent 10 years trying to push on something that we didn't have the right stakeholders in place in order to then to move the numbers. So like being able to look at that and say like, hey, this isn't working. We either need to abandon this metric or we need to reconceive what this campaign is going to be in order to move forward. Or this person just implemented this new policy, which then has direct impact on our ability to run this program effectively. We either need to make this more publicly aware and go after it, or whatever it is. Like there's not enough speed to transition because again, there's this fear of this is going to look really bad to the politician who made this program possible. And you have so many pet projects that are coming down of like, this is the Secretary of Health of this state's like number 2 priority. And so like you have to push hard on it. And if it's not going right, you're like, well, this person will be in office for 4 years. And so like, we're just going to plug away and wait. Like it's that sort of stuff.
Wait it out. Wait for them to run out the clock.
Yeah.
Let it running. What do you, I mean, when I was just thinking like, what are the biggest, state level public health wins over the last couple of decades? The one that like is almost just for sure there, which I don't know that it was fully addressed. I think it was part of Healthy People, whatever, but is smoking status. And there still is lots and lots of tobacco smoking that's happening across the country, especially in parts of the state with just economic depression and all other kinds of issues. Like, of course, there's still cigarette smoking, but we've seen dramatic improvements and reductions in cigarette smoking or tobacco.
Yeah, and then
consumption.
we got lazy as a country of smoking. Like the nosedive in is one of the greatest successes. That and vaccines, like the fact that we could eradicate a disease.
Kat's
incredible.
favorite. Kat loves vaccines. Everyone, she is a biggest fan. All of her Maha friends should know that Kat is big on vaccines.
But I want to jump to that in a second. But just coming back to smoking, we had all of these tools. We had both the right messaging at the national level, national politics, local politics, et cetera. So we see these rates decrease. We're getting science into that as well of like, well, what are those causal relationships that are leading to cancer, et cetera, et cetera. We're doing really well. We back off of some of the mechanisms, and Kat's going to hate this, but again, plenty of evidence to show the sin taxes and tobacco tax and stuff are effective, but then you get kind of, but when you don't have state coordination, like you could raise the price in this state, you go across the border and you get it at half the price. And so like then tax policy doesn't work at all. So let's take that off the table. Anyway, so we're seeing a decrease. And then what happens? We bring in vaping, and now we're seeing all different sorts of diseases that we didn't really pivot hard enough.
Right.
So like, well, what are the impacts? And you had researchers on the margin, but like a national campaign, and I'm not saying a federal campaign, but just each state working with each other, health officials, private sector, whatever, community-based organizations, completely underutilized just generally in health, or not recognized for the contributions they can make in keeping health local and effective. Like we didn't pivot hard enough. We didn't use some of the tools, and we didn't adapt the tools that we should be using to really address it. It's just another way in which we're destroying our lungs. And again, whether not saying, I'm not trying to come up against individual rights, but it was an example of, it was very effective. We had a good strategy, and now we're not really getting back to that for something that I think will increasingly be more dangerous. Or we'll see. Let me fix that. We will see the economic impact on workforce development, et cetera, as then these lung conditions come back.
Yeah.
So what, Lucas, why do you think we didn't do it like that when vaping came along? Is it because it was like the tobacco stuff was like programmatic and it was based on like cigarettes?
I think it's what you said, Lucas. We got complacent. We saw was it just
that? Yeah.
It was truly a big success, and it was like a cultural and a practical and a medical and it was a wide-ranging success in reducing the rates of cigarette smoking or tobacco smoking.
Well, I think in general that public health, and not just government officials, but even clinicians and everything else, like we were just not prepared for a very well coordinated campaign by industry to introduce a novel solution. And it was, oh well, it's not tar and everything else that you see in a traditional cigarette, so like, yeah, how can it be bad? And I mean, I was in a meeting at a previous job where we were working on trying to increase investment in preventative care overseas, and trying to bring the private sector more into being a partner of these foreign governments to do it. And one of a potential partner company had come in to talk to us. And he had a box, and he opened the box, and it was filled with various vapes. It's like, here, why don't you try some? This will help. And then the pitch was, this helps with smoking cessation. And that was the messaging of, instead of smoking a cigarette, just vape. It's healthier for you if you do it. And there is evidence that suggests that. And so then everyone's like, oh, well, it's better. It's an alternative to taking Wellbutrin or something else. And so again, everyone was caught flat-footed.
Kat, did you just open something on your computer? We're getting some weird feedback sounds. We were. Okay, fine. Anyway, nicotine's a drug. It makes people feel good. People like drugs. Like it's also that simple. Like, and the people who market
America.
That's
We can take drugs too.
Yeah. And I'm not saying we need to take stuff. I want to be very clear, because I know your audience is very passionate. And I don't want to get a bunch of messages on LinkedIn of I'm a socialist. I'm not. Simply, we need to do better on just allow people to make informed decisions, allow them to understand, and have the systems in place in order to support that. Because again, whether you want to drink 400 bottles of alcohol, there's not a law that's going to prevent you. There will be laws prevent you from getting in a car, driving, etc. But if you want to consume that, understood, it's just a matter of how then do we prepare and position the healthcare system then to take on a new disease category that then ultimately affects the economy, right? And it affects well-being and making America great. If we have increasingly sick people, then there are larger impacts. And so how do we account for that?
Yeah,
that's right.
Yeah. Well, I will say my driver told me he switched to vaping to be healthy. So, it's cool.
Yeah, I mean, it's healthier.
Yeah. Yeah.
And like everything in public health, it is a trade-off. And
Yeah,
for adults who currently smoke cigarettes or tobacco, it
yeah,
is healthier in most cases for them to switch to
right,
vaping. It is not healthier for a teenager who didn't smoke to start
correct,
vaping. Not
correct.
the same
not the same.
thing.
Yeah,
Okay.
so can we? Mhm.
Oh, go ahead. Go ahead.
No, I was going to say, jumping to vaccines. I mean, listen, what I would love to do from a policy standpoint, again, I don't want to say like we need to mandate X, Y, and Z, but we know it's one of the most cost-effective technologies, approaches we have in public health. It's one of the most powerful tools in our arsenal. And don't want to get into a libertarian fight, and I will try not to say that I find it totally intellectually lazy. However, I will say what I do believe of.
Cooked. He got
Um,
you.
no,
He
no, no, no,
got
no.
you,
Listen, no,
Kat.
no. It's like a throwaway thing. I
He
don't.
just
I mean, it's
snatched your wig, Kat. That was
no, 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 no. I listen. What I would love to see introduced of we don't have to, or as an insurer, I don't have to make you take any treatment, but I'm also not obligated to cover the impact of your decision. You make the decision,
that's right.
but if it leads to an outbreak, and this goes to like the whole waste thing. The biggest waste for me in public health is when we have to spend resources addressing an issue that we don't need to address or shouldn't have to address. Like measles outbreak containment is a massive cost to a public health system that doesn't have a lot of money to go after something that can be totally avoided. And so, and this would never happen, and there are ethical reasons why you couldn't do it, but we've done it for other things. You should not have to, insurers should not have to pay or cover your costs for an outbreak, and the person should be held accountable to pay back a portion of that response. Of again, it's the same. It's God, was it Hoover someone of you have the right to speak, but you don't have the right to be heard type of thing. It's the same thing I would say for some of this. Of you have the right not to choose a certain treatment, but you don't have the right to have that cost covered by the risk pool that's in your insurance scheme.
I'm into
Now,
it.
again, there's all sorts of stuff like why you should and can't do that, but like part of it is there are no financial risks for decisions for things that are avoidable, because ultimately there are people who can't be vaccinated because of other health conditions, and so like herd immunity only works in certain areas, and clearly it's not working in for measles in certain communities. And so there needs to be consequences in our decisions, like there is for everything else, which I think would please the libertarians. Of like, you have the choice, but there are consequences to that.
Love it.
Yeah.
Do it. Not mad about this. This is a great idea.
Many asterisks, including kids who don't get to
Correct.
consent. But like you were saying, it's
Correct.
complicated. But also, like,
Right.
if somebody who is an adult in like, a sound state of mind makes a decision like that, like, I don't personally feel excited about paying for their avoidable hospitalization for
Right.
measles. Just saying.
Yeah.
Right. And listen, you could, you could bring this to the next level. Like, oh, well, then why are you having a Coke, or why are you,
Totally.
like, you could go to extreme on all of this and just say,
a very
right, exactly.
slippery
That's why
slope.
none
Yeah.
of this would work.
Yeah.
But those are kind of the models I've been thinking about and playing with, and trying to put some data behind of like what is the real cost, and then that's the waste. That's the waste that we need to figure out how to eliminate, because there's just not enough money in public health to do that sort of stuff.
Right. Okay, so
Sorry.
culture. I know that's one of the big criticisms of big CDC too, right? Like there's a culture of risk aversion. They don't want to, whatever. We don't have to go into all the bullshit. But what would, if you had a magic wand, how would you implement such a culture change where failure is okay?
At a federal institute, I mean, listen. The only way culture change happens,
fix the CDC.
CDC is hard because the mission's not well understood for people outside of CDC. So when there's a failure, it's because they don't know what they're doing. It's within the context of what's the mission of the organization or the company or my role within this. And so there needs to be transparency in what this thing does, and there needs to be understanding within the community of then how does that impact us. And so for CDC, I think people just assume like, oh, well, their role was to be the people in lab coats that show up and address an outbreak. Like that was never the intention of the CDC. The CDC cannot require states to report data. The CDC can't do it. And so it really is a technical advisory organization, but people think it's something else. And so you're constantly being attacked for things that are not part of your core value or core mission. And then it gets, then they throw in the politicization of it. And so it's hard. So to be able, I don't know how to answer your question, because I think, that's, I don't know, because I think it's like, it's at this point, it's untenable for the organization.
Yeah. All right, let's talk about fixing it a different way. So we're not gonna figure out the culture thing, but we know the facts here, right? CDC kind of got doged. It's going to continue to get doged. There's lots of changes ahead. A lot of things are moving to other agencies. If you were CDC director, Lucas, BigDataDaddy, what would be your top 2 priorities? You could do 3. You can have 3 if you want.
Of the new CDC or
the new
CDC? I don't know. Wait, so just educate me, Kat, because what is the CDC right now? Then that'll help me figure it. Like, realistically, what is it right now? And then I can come up with priorities for what the thing is right now, or what the thing will be. Or Lisa, you tell me. Anyone tell me what the CDC is supposed to be doing in this new reorg.
We do not know the answer to your question. Crickets.
Well, there's some stuff.
Trying to help out with like really urgent outbreaks across the country in different states and localities, and not having enough staff and having to turn down those legitimate requests for epidemiologists and investigators from states.
Yeah. All right, so that could be one. So
that's real.
Our role in trying to be American exceptionalism with being the international, or being the country who has the experts to tackle X, Y, and Z. Like, does the CDC have a role in international and global health anymore in our new CDC?
Doesn't seem
like are we
I think
the
they
one
pulled
that
out of
go?
WHO like fully, like they're not getting super involved.
Forget WHO, like just from my experience,
inspectors in other countries when things are coming into the US, or
no, like for example, so my wife's a diplomat. We lived in Uganda. I got to do a lot of global health work there through the embassy. The largest, well, I'll say this. The best yellow fever lab on the continent was run out of Uganda, and the technical assistance from CDC was tremendous in a true partnership of not only identifying yellow fever, but every single infectious disease that was emerging out of the continent was coming through that lab. And the work was being done by Ugandans, but the CDC there was hand in hand with technical assistance, which then enabled intelligence and everything else to be collected to the United States, then to be able to respond to the risks then to troops and other things that are happening, because of the fact that we were hand in hand with organizations, right? So does that go, that enabled the United States to really have a prominent role, not only in this case, but for all global health of PEPFAR program in Uganda, technical assistance through CDC, funded through USAID, et cetera, which really stabilized the region, which then enabled opportunities for us that we didn't take advantage of, et cetera, et cetera. But like that role of CDC, is that in or out? And if it's out, okay, so we go back to it, and then it really becomes data modernization. I think the toughest thing, and this went to, and I would talk to Dr. Lade and the whole team there, who I adore, on data modernization is hard, because again, it goes back to like the states don't know how to spend that much money without the risk of
with no sustainable long-term.
If you don't get the system right, because even on the private sector, you're building stuff and you're realizing like, oh wait, that system didn't work. Our implementation of AI isn't working. We need to pivot, and it's going to cost money. Like, you can't do that at the state. So how can you help the states de-risk these investments? Because these are not small investments. They're run by teams that don't typically run technology because they're epidemiologists. They're not technologists. Now that's changing. There's a lot of upskilling, which I think is hugely important, and also a central role of how do we give new skills to people who may have even graduated graduate school 5 years ago, and the sands have shifted. So how do we give them the skills? But like an agency, I would imagine there needs to be an agency that can provide that sort of assistance to how do we effectively address this aspect within our program in order then to give us cover.
Yeah. Yeah. So how do you enable the states so that
how do we spend money? Yeah, you're giving us money. Now we have block grants coming. And now the state, the responsibility of like, oh, there was guidance coming from CMS or CDC or whatever, and we had to do these types of programs. That's out the door, right? Now we're going to get a big chunk of money. And now I have to figure out, how am I going to spend it? How am I going to build these programs? How am I going to do it? I'm very smart. I'm, very capable. I have a capable team around me in my state office. But if I screw this up, the governor is going to know, and it's problematic. So like, how do we help provide the resources necessary to make all these teams successful in ways that they haven't traditionally been spending money or investing in these programs?
Well, America, we are out of time with BigDataDaddy, but I feel like what he's saying is the devil's in the details. There's a lot of stuff going on.
Not that simple.
Not that simple. Can't just abolish the CDC. So, Lucas, thank you. I know that you changed your flight on our world famous, widely watched show. So
that's the commitment we like to see from our loyal, amazing guests and our loyal fans. Thank you all.
Thank you for the opportunity, and happy Mother's Day to you both, and to all the mothers out there this weekend. Thank you for everything you do.
You're welcome. Happy to do it.
Happy Mother's Day to Kat's mom, in particular, who has adopted me or something. I don't know.
Yeah. My mom has adopted every single one of my friends, but has a particular affection for Lisa. So she's very proud of Lisa in her new role at Innovator. So thank you, Lucas.
Thanks, loyal fans.
Safe travels, and thanks, America, for joining the show. I'm sure you learned a lot.
All right. See you soon. Thanks, Lucas. Bye, everyone.